In the war against COVID-19, this is one of the places the fight is most intense. But instead of guns, these soldiers are using disinfectants.
We've been going to treat facilities to take care of Georgia's most at-risk residents to prevent the spread of COVID-19.
It's part of an evolving battle plan to save the lives of people living inside nursing homes.
Now to the staggering toll at the nation's nursing homes and assisted living facilities.
The outbreak is taking a toll on nursing homes.
The governor now issuing a series of mandates tonight, including limiting visitors to nursing homes.
An ABC News tally counting over 10,000 deaths in 26 states. I was there as the outbreak began in Kirkland, Washington. We've just seen another person loaded up into this ambulance to be taken to the hospital. And over the weeks, the body count in facilities has continued to rise. 49 in Virginia.
One of the deadliest COVID-19 outbreaks at any assisted living facility in the country.
Just this week, 41 in Andover, New Jersey.
It started with a desperate call over the weekend for 24 body bags.
And relatives are demanding answers.
Nobody should die like this.
As the president touts the federal response to nursing homes amidst the outbreak.
We're taking very special care of our nursing homes and our seniors.
Critics say the administration has mishandled the situation on multiple fronts.
Clearly, the federal government has been slow. They said, well, we're not really responsible. The states are responsible. To this day, we still have the Trump administration battling governors of both political parties.
Some pointing to the shortages of protective equipment and testing in the facilities.
We've been saying for the last month and a half that if we don't have testing in nursing homes, if we don't have personal protective equipment, things are going to get bad.
Others calling out the low wages of many nursing home workers.
Those who care for young kids and those who care for our parents and grandparents in these facilities are often among the lowest paid of our workers.
As we look back at the Trump track record, they constantly minimized what this was all about.
Senator Ron Wyden co-signed a letter that says before the pandemic, the Trump administration repeatedly weakened nursing home safety standards that put residents at greater risk to infectious disease outbreaks.
They rolled back regulations with respect to preparedness, making sure, for example, that there was coordination with local and state officials.
Wyden's letter coming as the nation's first COVID-19 crisis unfolded.
Well, Kirkland, and the facts are still coming in, should have been a wake-up call.
The virus began its silent assault on the life care facility in Kirkland, Washington in January. By February, the 911 calls poured in. One
Life Care Kirkland
after another.
He is deteriorating in his health condition.
And another.
911 emergency.
Medical, please.
Is this the Life Care Center?
Correct.
Okay, what are her symptoms today?
Her vital signs are okay, but she's also sweating, clammy, having a hard time breathing.
So now she's running a temp and negative for flu.
At the end of February, the center came to realize that COVID-19 had infiltrated their facility.
There's a lot of sick people in there.
Life Care saying they grieve with the families who have lost loved ones, people who were important members of our professional family. Current residents and associates continue to be monitored closely. By early March, the federal government was compelled to issue some guidance, advising nursing facilities to screen visitors with symptoms of a respiratory infection.
Seniors and Americans with underlying health conditions are particularly vulnerable.
At the time, 159 cases of COVID-19 were reported around the country. Yet this was still 8 days before a national emergency was declared about the COVID-19 outbreak.
As soon as we saw cases that were taking place in Kirkland, we should have recognized that this is an alarm bell that is not just specific to one care facility, but actually has repercussions across the U.S.
To date, 37 lives at Life Care in Kirkland lost, a heavy toll on the employees who were inside.
I knew a lot of the patients, and some of them hadn't been there for a really long time.
Some of them would crash real fast. They'd go from 0 symptoms to crashing in 3 hours. The turnaround time was incredible. It's like nothing I've ever seen before in my life.
In the wake of Kirkland, Mark Parkinson, the president of the American Healthcare Association and an advocate for nursing homes, believes the federal government should have prioritized testing.
A nursing home resident who has symptoms of COVID, even if they have underlying health conditions, is a priority level 2. And so what that means is that we can get them a test, but we probably can't get test results for 7 to 10 days. And a lot of really bad things can happen in 7 to 10 days.
As the outbreak continued spreading across the country, state regulators tasked with responding to the crisis found themselves fighting a losing battle.
At the facility, we've had 108 individuals test positive for COVID-19. Of those 108, 39 of those individuals have been showing symptoms.
Danny Avula is the public health director for the Richmond District in Virginia. He was part of the team tasked with addressing the spread of COVID at the Canterbury Rehabilitation and Healthcare Center there. He says they tried to contain the virus by isolating residents showing symptoms.
I was not necessarily surprised by the number of total positives, but rather it was the number of people who were positive that were not showing symptoms at all.
If you don't have symptoms, it's very hard to make a decision to isolate people. And so by the time that it was identified, there was probably a huge amount of transmission events without people even knowing they had been infected. And that made it incredibly difficult to control.
Part of COVID-19's cunning, the way it hides and shows no symptoms. And with asymptomatic carriers moving freely about, the Canterbury Center soon found itself overwhelmed with cases, becoming the first facility to surpass Life Care in Kirkland in fatalities. 49 residents dead in 3 weeks.
I really didn't realize it until the news article came out that they had a number of deaths there.
Precious Turner's uncle lives in the Canterbury Center now. She says that he has tested COVID positive and relies on the staff there to keep him safe.
These people are risking their life every day to go into work to take care of my uncle. So I'm extremely grateful for them.
Canterbury credits its staff for tireless work during an unprecedented time. According to the Bureau of Labor Statistics, personal care aides made an average of around $24,000 a year in 2018. And now some of these aides are putting their own lives on the line for the residents. At this facility outside Columbus, Ohio, the employees have even volunteered to lock themselves in with the residents to avoid asymptomatic spread and give the vulnerable their best shot at survival.
Between 22 and 24 individuals volunteered to give up everything outside this world, whether it's being with their kids or taking care of their own parents, to come here and take care of our residents and our loved ones here.
The facility says with the lockdown, they still don't have any COVID patients.
We need folks that have healthcare backgrounds to be rallying around these facilities and flocking into them to help in the same way that we saw for the hospitals.
In some states, local volunteers have taken it upon themselves to help out.
Right now we're gathering the donations that we've been able to procure.
Leanne Spitzer and her group in Sparta, New Jersey have mobilized to support the Andover Subacute and Rehab Center 1 and 2.
They've basically just asked us anything that we can do, any sort of PPE protection, if we can get it to them to please do that. They are putting their life on the line every day to take care of these people, and they really need the recognition they deserve.
It's a nursing home this group says for weeks had been asking for help and became a national story when that ask became for body bags.
A gruesome discovery in Andover, New Jersey. Police there found more than a dozen bodies piled up in an overcrowded morgue.
That's Larry Togno, my uncle.
Beth Gange's uncle was a resident at Andover when he died on April 6th. She believes, but says the facility does not know whether his death may have been related to COVID-19.
Family members can't even go and see their loved ones right now.
To Gange, the tragedy was a complete shock. She says that just a few days before his death, an Andover staff member called her family to tell them that her uncle was being taken to the hospital.
My dad got a call at 2:30 in the morning here in Florida that his brother Larry had been taken to the hospital with a fever. The next call we got was 4 days later saying that my uncle had died.
The state's attorney general has opened up an investigation into the high number of deaths at multiple facilities, including Andover. Last year, Andover was rated much below average on their health inspection, receiving a 1 out of 5-star rating from Medicare.
The survey process that's been used for nursing homes throughout the years is just broken.
Andover saying that they remain confident that a state review will confirm that the facility has been addressing the unprecedented challenges from this pandemic appropriately. And due to patient privacy concerns, they were unable to discuss individual patient details. As for Beth, She's mourning her uncle, her grief fixated on the isolation she believes he endured in his final days.
My uncle died alone. Nobody to hold his hand, nobody to pray for him, nobody to tell him, it was gonna be okay or anything. He died, I'm sure he died gasping for air. And it breaks my heart. Nobody should die like this.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.